Is surgery recommended in diabetic retinopathy? This is Dr. Anina Abraham from Advanced Retina Care. Surgery is definitely recommended when retinopathy becomes extremely severe. Remember that diabetic retinopathy has different stages. If you have reached a stage where the jelly of the eye or the vitreous is pulling the retina and causing a retinal detachment, you will require surgery to preserve vision. Is there a risk? If you do this when you have normal vision, is there a risk? Yes, there definitely is a risk because there are a lot of bleeders on the retina in diabetic cases. And this can cause bleeding. You can have retinal tears while operating. You can even lose vision when the surgery is done. It is extremely important to do this surgery most carefully to ensure that no complications happen when you're treating a case of diabetic retinopathy. However, if it is done carefully, surgery will save your vision for life. The reason is diabetics become blind only because of that jelly. If that jelly, the vitreous, is removed completely in a proper manner and all the membranes are removed from over the retina, vision can be preserved for life. Again, another risk is when blood flow is compromised during the surgery or prior to the surgery, even with an anesthesia injection. If blood flow is suddenly compromised to the optic nerve, there are cases in which the optic nerve suddenly becomes pale. It becomes white instead of becoming pink, instead of staying pink, which means that vision is lost because of this. This is another risk when you are undergoing surgery. However, patients who have diabetic retinal detachment require to undergo surgery to preserve vision. If you don't undergo surgery, the risks are much more than when you undergo the surgery. You must understand this. Today you may have decent vision, you're able to move around, you're able to do your things. But if your retina is beginning to detach because of diabetic retinopathy and you've not got it treated, it's just a matter of time before you lose that vision. Surgery in time can save vision.